Hi, this is Dr. Bob Dannenhoffer, the Public Health Officer from Douglas County, with another of our Facebook Lives. So it's now Tuesday, October 27th, 2020, and we're going to do this again. Everybody else has left the room, so I'm able to take my mask down. Phew, that was hot. Again, Dr. Bob Dannenhoffer, the Public Health Officer for Douglas County, October 27th. Again, this is a chance for you to ask questions and for us to answer them. Again, if you could put this in the chat section of the Facebook Live, that would be great. Change for Friday. Instead of 6 o'clock, we're going to do it at 4 p.m. This will give chance for some of our staff to have at least one Friday night at home. They've basically been here every Friday night since March. Okay, so let's go through this as we always do. Start at the world, move down to the local arrangement, and then take your questions when they come in. So if you have them, please put them in the chat section. Vanessa will pull them up and send them to me. Okay, so in the world, still a really active pandemic, 44 million cases and 1.17 million deaths. The number of cases now is increasing at a steeper rate than it has any time in the recent few months. If you look at this logarithmically and plot it out, it looks like by the end of the winter we're going to have 100 million cases and 2 million deaths in the world. I mean, that is a stunning number of deaths. You know, you hear about deaths due to starvation, deaths due to war, deaths due to other things, and this will be clearly the leading cause of death. Still really active in the U.S., India, France, United Kingdom, and amazingly Switzerland, a relatively small country that's had just an overwhelming number of cases. But at the same time, still very quiet in Taiwan, Singapore, New Zealand, Australia, and oddly enough, Uruguay, because the rest of South America is having a zillion cases. But it looks like Uruguay has been able to keep it quiet. And that will be one of the big questions, is how Uruguay was able to buck the trend in South America. In the U.S., still incredibly active. We had 2 days on Friday and Saturday with over 80,000 cases. I mean, that's the most cases we've ever had in a day, and they have 2 days in a row. And even over the weekend, where the cases usually go down because of less reporting on the weekend, we were still at 60,000 cases on Sunday and over 70,000 cases already today, and we're not even close to the end of the day. Still really active in Texas, Florida, Wisconsin, the Dakotas. The stories from the Dakotas are really heartbreaking, you know, where the hospitals are full, they've had to cancel elective surgeries. You know, we talk about Rapid City, South Dakota, which is having just a slew of cases. You know, we feel busy when we have, 7 or 8 cases a day. You know, that's like overwhelming for us. Twin Falls is having 79 cases a day, 79 cases a day, 10 times as many cases as we're having. And Twin Falls reported that they've had to change elective surgeries in the hospital, and that it's hard to staff the hospital. So really a worrisome in many other areas in the country. However, it's relatively quiet in Oregon and really quite quiet in New England. So New Hampshire and Maine have had a relatively low rate of disease. Now, New Hampshire and Maine, if you've been to the New England, is not terribly dislike Oregon. You know, it's cool weather, relatively small town separated by big areas, and so we seem to be the areas that are doing well at this time. Oregon continues to have lots of cases, although we remain the 4th lowest state by per capita in the country, and the 6th lowest death rate. And our hospitalization rate is only slightly increased, as opposed to places like Idaho and the Dakotas and Wisconsin, where hospitalizations are taking a very steep rise. We're not seeing that much of that here in Douglas County. Hold on a second here. I'm checking what questions. Okay. All right. In Douglas County, still a lot of cases. We had 35 cases last week, far and away our highest week. Just 9 cases now today and 3 deaths yesterday. So these 3 deaths are just tragic. One fellow, relatively healthy man, young, my age, who had been in a hospital here and then up in Portland for a while and finally succumbed. And then 2 deaths of people also in their 60s who were at one of our nursing homes got sick and then died. When we look here, still lots of little outbreaks. So we don't have any huge outbreaks now, but we have lots of little outbreaks. And again, related to travel, I have to do this when we add a new state. So Alaska, Washington, California, Arizona, Nevada, Idaho, Wyoming, Michigan, Louisiana, Florida, Texas, Ohio, Missouri, Tennessee, Massachusetts, Virginia, Montana, Minnesota, Utah, and this week we added North Dakota. So again, travel from outside the areas, then people continue on their regular activities. A few days later get sick or find the people they were with were sick and give it to us. The other thing that we're seeing this week, and several of the outbreaks have been related to people who were sick and went to school. So one of our school outbreaks, a kid was sick for a day, still went to school and spread it to 67 others, or exposed 67 others at school. Again, if you're sick for any reason, you need to stay home. Now, I know in the past we'd all go to school, we'd all go to work if we were a little sick with a cough or a fever or some diarrhea. This year, you can't. This year, if you're sick with anything, you need to stay home, because if you go to work sick, you are likely to spread it to the others and cause a big problem. So, what I've told parents is expect lots of absenteeism this year. And expect your kindergartner or first grader maybe to have 5 or 6 weeks of absence this year, which would be far more than typical. But the alternative is going to school when you're sick and then the whole school being shut down. So that's it. But we've also seen adults do this too. Adults who are waiting on results of tests go to a party and expose others. What are we thinking here, guys? If you are sick, stay home. If you're waiting for a test, stay home. Okay, so we got some questions. So a friend of mine says it's proven that this was a man-made virus. Can you shine some light on that? I don't believe that. Well, if this guy can show that it's proven, so he should just show me the proof. I'd be glad to look at the proof. This virus does not look anything like a man-made virus. We can make man-made viruses. In fact, these vaccines are going to be man-made viruses. They look nothing like any of the man-made viruses before. And so if he can, so I don't think I can prove that it's not. He should give me some proof that it is. I know there have been some right-wing websites that have suggested this. I don't think anybody who understands this thinks this was a man-made virus. Some people are claiming that there are no flu cases now that COVID is here. Can I address that? Well, it's a little early in the year. We don't usually see lots of flu until November, December. There is not much flu here yet because it's not November, December. We've had a few cases in Oregon and one case of influenza B in Douglas County. We hope it doesn't come. We were hoping that the face masking that people are using, the social distancing, which will stop COVID, will also stop flu. So we're hoping that there's not going to be much flu this year. For example, in Australia, which typically is 6 months ahead of us, they did not have much flu. They think because they also gave lots of flu vaccine and because they did social distancing. No flu cases now that COVID is here. I don't get what that means. Okay, so Monica says, are there any official updated guidelines for schools from the state planning conference calls I referred to last week? Oh, still a lot more calls. There's a lot more calls, so there's no official updates, but there have been a lot of calls, so my ear is getting sore. So somebody says, I'm a mask supporter, but getting a lot of heat because CDC says that 70% of the people who wore a mask got COVID. Don't think anything could be further from the truth. So again, what they did was, and I have actually read the study, and so I'd encourage you to do it. You can do what's called a CDC case control study, and it looks at the different things that people did. So what it showed was they took people who had COVID, and then they found people who were at that clinic who had other respiratory things and didn't have COVID, and then compared them. And so case control studies are done for a long time. Case control studies are great studies to give you hints about what the difference is. So let me give you another example where you do a case control study on a foodborne outbreak, which we do all the time. So let's say you have 100 people who've got salmonella and then 100 people who don't, and you say, how many of you ate raw sprouts? And 23 of the people who don't have salmonella did, but 100% of the people who have salmonella did, that would be a strong idea that Sprouts had something to do with the salmonella outbreak. So case control studies are very interesting when you see a difference between the groups about what the risks would be. And so what they found was that mask wearing was a little more common in the people who did not have COVID as compared to the people who did. But still, a large majority of the people said they wore a mask some or most of the time. What was different, though, is that the people who had COVID were more likely to have eaten out, more likely to have been to a bar, and more likely have been to a place where others did not use masks appropriately. Those were the ones that were really striking and showed that was the difference, that if you go to bars, especially where people don't use masks, that your risk would be higher. And that's what it showed. There were some people who suggested this meant that masks weren't working or whatever. That's not what it was supposed to show. And the CDC said that's not what it was supposed to show. And so that's just I think, craziness. All right, so go back here one more time. So Zay says, I had a sinus and double ear infection on many antibiotics. But people are saying this is caused by wearing masks. We have nothing to suggest that ear infections or sinus infections are caused by wearing masks or not wearing masks. Sinus infections or ear infections have been around for a long time, and they happened before we had masks and after we had masks. There's nothing that I know of that suggests that masks would cause those things. So is there anything new regarding people being able to get COVID a second time, Sherry asks. Maybe. There is, again, those two very well-documented studies in the U.S. where people clearly got infected a second time and were much sicker the second time than the first. Since those studies come out, there are lots of anecdotal stories of people who were hospitalized who said, look, I had this before, and indeed, you can say they had this before, but they didn't exactly have the virus itself before, so they can't tell if it's a new virus or a different virus, but very clearly, they tested positive months before, and now are in the hospital sick again. So I think the data is emerging that at least for some people, you can get this again, which for at least some people makes us worry how long the immunity lasts. Now, again, most of these other stories are anecdotal, that they're there. You don't know what the denominator is. People report this. And, if it's 10 cases out of 10 million, that wouldn't be so bad. And so we're not going to know this until somebody does a more systematic survey of places like New York or Italy, where a lot of people had disease before. So any idea why we were suddenly breaking records in our numbers in our nation? Are we just testing more, Sandra says? And the answer is, we are testing slightly more, but has nowhere near enough to explain. So if the problem was if the idea was we're having more cases simply because we were testing more, only because we were testing more, what you would expect was the number of cases would go up because you were testing more. The positivity rate would go down because as you're testing more, the number of positives of the total number of tests would go down. So your positivity rates would go down. And hospitalizations wouldn't change at all because the cases you would be finding by this asymptomatic or other testing are people who are relatively well, relatively asymptomatic, and certainly wouldn't wind up in the hospital. Deaths wouldn't go up either because, again, the people you'd be finding would be relatively well people, asymptomatic people. But what we're seeing is the number of tests has been pretty stagnant. The positivity rate is up, the hospitalization rate is up, and the death rate is up. So almost all of the increase is related to more disease, not to more testing. So can I tell us something that you read about COVID that surprised you lately? So yes, so there was an article in, I read a lot, so there's going to have three answers here. One was in JAMA Ophthalmology that looked at people in China who got admitted to the hospital for COVID. Their rate of wearing glasses was only about 6%, and when other people their age wore glasses 30 to 60% of the time. So it looked like not wearing glasses was a real risk factor for getting admitted. Simple study, but really quite nice. The second was a study from the VA that looked at hospitalizations for flu and hospitalizations for COVID. And so what they found that, not surprisingly, most of the people got admitted for flu are older, Many have underlying conditions. So in that way, the admissions for flu and COVID were the same, but the risk of developing acute respiratory distress syndrome, that is the terrible lung disease that kills you, was 19 times more likely with COVID than with flu. So yes, flu and COVID are bad, but COVID is, as we said, 20 times worse, and another study is suggesting that COVID is 20 times worse than the flu. And for admissions, they were 5 times as likely to die of COVID as they were with flu. All right. It's not working exactly right today. We're going to have to update this as we go. All right, so a couple of other things here. So we've had a number of school outbreaks. We've had 2 school outbreaks today. Not everybody was notified, so I can't tell you where they're at, but two outbreaks today, and each of these outbreaks have so many contacts, right? So one of our cases had 67 contacts. A very, very, very big worry, because that means lots of families in quarantine. A couple other things on the vaccine front. We've been able to restart the AstraZeneca vaccine trial in the U.S. So this is a vaccine trial, is from AstraZeneca and the University of Oxford, that uses a chimpanzee adenovirus with the COVID stuff stuck in it to generate immune response. It was stopped when there's an incidence of transverse myelitis in England. So transverse myelitis is inflammation of the spinal cord, really very serious, where you get numbness and weakness below the lesion in the cord, and it can be long-lasting and really a terrible thing. I can't imagine being paralyzed from a vaccine, and that's why people really worried about this. But they did the safety things, and they said it was safe to restart the vaccine trials. Interestingly, there's been enough worry that there's going to be political pressure at the federal level to approve a vaccine before it's safe, that the Western states are going to actually review all the data independently of the feds. It's the first time we've done that, but I think that's probably prudent, given the fact that there's been so much stuff about this. And the problem is going to be that if people don't trust the vaccine, you can have the best vaccine in the world, and it's not going to do anything. Okay, let me see if I have more questions here. Oh my goodness. So how can we fight COVID fatigue? I'm a total introvert and still sometimes feel like throwing my mask off and hugging a stranger. Well, don't hug a stranger. Probably better to hug a family member. But I know what you mean. So there's 3 things that are happening. One is the weather is getting cooler and people are doing more things. And as they're doing more things, there's going to be more spread. The second is there's COVID anger. A couple of really nasty stories over the weekend about people doing this, a stabbing in Chicago about somebody who wouldn't wear a mask. So there's real anger in this. So to get from, hey, would you put a mask on, to I'm stabbing you, suggests that there's built up and pent up anger there. And then the third is fatigue. This is a long time. I was in the Navy for a long time. And, they only have ships go out for 6 months at a time. They don't have ships go out for 5 years. They go out for 6 months at a time, because after 6 months of the high operational level that you have in the military, you just can't really maintain that after 6 months. People get tired, they get fatigued, they get angry with each other. We're now in this, we started thinking about this really strongly in the second week in February. It's now the 3rd week in October. It's 8.5 months that we've been doing this. It's a long time. I, for example, have been doing this right every Tuesday and Friday. I don't think I've had any days off since then, so it's a long, long time. And what happens then with fatigue is that you start to get maybe short with people and whatever. I've tried not to get short with the Facebook audience, but it may happen. Uh-oh, something's happening here, Brian. Anyway, okay. So what can you do look for the positive things? And we've had some positive things. I just had one today. One of our new cases got diagnosed today, and it was her birthday, her 12th birthday. And so somebody on our team went out of their way to go ahead and say, well, you couldn't have your birthday party. So they got a birthday cake for him. I mean, it's just a little thing. It's not the end of the world, but I thought that was incredibly sweet. So I think what we need to do is just think of nice things, fun things. So I went out to dinner last week by myself, socially distanced. And when I asked for the check, they said, oh, somebody else got it for you. Because they were thanking me for everything that I'd gone on. So little acts of kindness like that are some of the things that we can do to help pandemic fatigue. There are a couple of other things I would recommend. I have noted that people have said they get a lot less outdoor time. And we think outdoor walking and whatever is incredibly safe. We don't think that there's any dangers for going for a walk outside. And certainly could not have had more beautiful weather in the last few weeks. So the other thing we can do to help fight pandemic fatigue is go outside and get some exercise. Katrina says, how many cases did we have last week? Well, depending upon how you counted it, the way the state counts it is what's called this morbidity and mortality week. We had 35 cases, which is a lot of cases. Somebody says, schools are now telling us that face shields may not be allowed as approved face coverings at school. Is this coming from the state or somewhere else? So I would have you read the face covering guidelines. So in the past, Oregon allowed you to use either face masks or face shields interchangeably. The new guidance says that face masks are preferred, or much preferred, over face shields. And so that's where it comes from. Both are still allowed. But again, face masks would be preferred over shields. And there's something to be said for that. You know, back in the days when we thought this was the masks and the shields were just about protecting others, you could quite clearly see how a face shield would protect others. But a face shield doesn't protect you as well because there's obviously a lot of air around it where germs can come up and see. But I still think it's reasonable to allow either a mask or shield because there's some people just cannot use masks who might be able to use shields. And I just want to avoid a stabbing because somebody doesn't have a mask on, can't wear a mask, is not allowed to wear a shield, and there's something like that. So I think Oregon's rule that you can use a mask or a shield and masks are preferred is quite reasonable. Okay, a couple more things. The Binax Now testing is here. We've delivered these to 20 clinics in the county. So there are 20 clinics of Binax, which is this rapid antigen test. There are a bunch more clinics that have other testing platforms, either BD Veritor or the Abbott ID Now. So between the Abbott ID Now, the BD Veritor, and the Binax, there are over 20 clinics in town that have these available. These all give results within an hour. They're all reasonably accurate if you're symptomatic. So again, if people are symptomatic, stay home, call your doctor, get tested. If you're positive, we'll contact you. If you're negative, stay home until all well plus 1 day and then go back to work or school. So again, if you're sick with anything, stay home, call your doctor, get a test. If it's positive, then you're a case and we'll contact you. Chances are it'll be negative. Most of these are negative. Will be negative. You'd stay home until you're well, plus a day. If everyone did that, half of the outbreaks we have now would be done. We would be well below the 30, about to have schools opening, and we wouldn't have either of these outbreaks at school. So again, if you're symptomatic, stay home. And symptomatic means fever, cough, runny nose, sore throat, diarrhea, aches and chills, fatigue. You got those? Stay home. And you should stay home. You should seek testing. If the testing is negative, you should then go back to work. You then can go back to work or school when you're asymptomatic for a day. Now, you don't have to get tested. You could just wait until you're asymptomatic for a day. But we would like people who have symptoms to get tested so we can root out disease, because then if you're positive, we'll go back and try and find out where you got that disease from so we can hopefully stop it. So we really do want people to get tested. So again, please, 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 if we could have people do that. All right. So I see there is no difference in the flash alerts between PCR and antigen positives. So in Oregon, antigen positives and PCR positives are both considered cases. I think that's clearly the right way to do it. There are some states that consider an antigen positive an antigen a presumptive positive until it's confirmed with a PCR. That just adds so much more confusion. I don't think adds wit to the discussion. So there is no difference between PCR and antigen. But then the second question is, does the antibody testing still only recognize presence of any coronavirus? And so the antibody testing is blood testing that tells about previous infection. And the antibody testing, if you get it at one of the high-quality labs, actually is very good at distinguishing between SARS-CoV-2 and the other coronaviruses. And Beverly says again, can you please set up a drive-through flu shot clinic on the coast? And yes, I can. Beverly, you just have to message back as to who we might contact to get that done. When we do it here, we work with partners here in Roseburg to get it done. And if we were going to do that in Reedsport, we would need to work with a bunch of partners over there to help direct traffic and do media and those kind of things. So Beverly, you've asked us before, and I think we should to do that. So the next question is, did the 2 cases who died have any treatments or therapy to help COVID? So clearly the fellow that had been up at OHSU had all the therapies that were available at the time. And the people down here, I'm told, did have remdesivir. Again, when you think of what the therapies are, oxygen, everybody gets those. Dexamethasone, anybody who needs oxygen can get that. Remdesivir is, at least in Oregon, reasonably available for hospitalized patients. The monoclonal antibodies that the president had is not available except by a compassionate use. And again, that company has only granted compassionate use for a handful of people, less than a dozen in the entire country. So that stuff is not available necessarily for the rest of us. All right. Are you concerned about the high school students who did an informal homecoming dance last week? Yeah. I mean, we know high school students tend not to get particularly sick from this virus. You know, the risk of death from this in kids and teens is not zero. I mean, there are dozens of deaths from COVID in kids, so it does happen, but the risk is relatively low. However, what we do know is that teens are incredibly effective spreaders. So we think between 15 and 30 is your most effective spreading time. And that's the concern, is that these kids will get it, they won't get very sick, but they'll spread it among themselves. These people will then go home and kiss grandma and give it to grandma, and that's what the concern is. So some of this focused protection stuff says, well, we should just sort of isolate the seniors. But at least in our society and the people I know, that is very hard. I do pediatrics, and in the pediatric clinic, maybe 1 out of 4, 1 out of 5 of the kids come in with grandparents because they live with grandparents. The parents are away, they're in the military, they're otherwise indisposed, and they're cared for grandparents. So this happens, as well as we have a number of families now that are 3 and 4 generation households. So there's the kids, maybe a teenager. There's their parents who are in their 30s or 40s. That's their parents who are in their 60s and 70s, and then grandmas in their 80s. So everybody's living together, and that's actually quite a nice arrangement. We had that at one time at our house, and it's a way for the kids to have great relations with the grandparents. But the grandparents there are at great risk from getting sick, and that's what I worry about the homecoming dance. I mean, I don't think we're going to find much serious disease among the kids. But I think the kids are also going to go ahead and hug grandma and grandpa and go to family dinners and whatever else and spread it in that way. And that's the big concern. Okay, a couple more things. It looks like we're getting close here. So we had a viewer from Idaho who was concerned that I had talked about herd immunity, and what we're saying is that those places that have low levels of restrictions are basically trying out the herd immunity approach. Well, yeah, so basically the story is if you say we're going to have no restrictions, we're going to just kind of let this go through the community, the strategy is either we don't care about the disease or we're trying to get more people to get this so we can build herd immunity. However, if you look at the Great Barrington Doctrine, what it says is, yeah, we should do that. Plus, we need to do a lot to protect seniors. And they talk about things like, not in the doctrine, but in other associated documents, like making it so seniors can always have groceries delivered and pet care and lawn care and whatever, so that seniors can really be protected. Maybe in some places in the world that would work. There are some countries where multi-generational families are quite uncommon, and in which case you could do that. There are some countries where it is quite unusual for grandparents to be caring for grandchildren, and so it might make sense. But I think in the United States, because we have a lot of multi-generational families and grandparents caring for kids, it's going to be much harder. Again, on our doppelganger analysis in Twin Falls, 79 cases a day. They're now to 3,900 cases and 47 deaths. Again, we're at 8 deaths and think that's tragic. They're at 47. Rapid City, Pennington County, 4,183 cases, 48 deaths. Their hospitals closed for elective surgery, really, really struggling. And there again, 30 to 50 cases a day would be really, really hard to keep this under control. All right. So are we looking at another shutdown with so many new cases? Drink of water here. I don't know. So I don't know if we're looking at another shutdown. I mean, there clearly have been other places in Europe that have had this level of cases. They've been a little ahead of us. They've had a higher risk of cases, and they did have shutdowns. So again, you'll remember a month ago, more than a month ago, 5 weeks ago, I talked about Israel. And what I said is Israel in many ways had some of the same conditions as the United States. They had a small first wave, a bigger second wave, and then the steep early wave in August and September, a few weeks after they'd opened schools. And so my concern was that they seem to be about 4 weeks ahead of us and that we may be 4 weeks behind them. Well, 5 weeks ago, they did a lockdown, a second lockdown. I mean, the first lockdown was hard enough. I think a second lockdown would be incredibly hard. But after their second lockdown, they've now seen a decrease in cases, and I think this week, a decrease in deaths. France has increased restrictions. Spain has increased restrictions. The UK has increased restrictions. Even Idaho had some mild limit on gatherings, some mild restrictions today. So I am seeing around that other people are starting to have restrictions. Again, in the U.S., I haven't seen any place go to a lockdown. And really, if you looked at places in Wisconsin and the Dakotas, those would be the place to do it, and we haven't seen that yet. So I don't think we're looking at another lockdown, at least in the near future. But again, so much of this is changeable. Like, let's not do that homecoming dance. Let's not go to school when you're sick. Let's not go to parties when you're sick. If you travel from another place that has a zillion cases of disease like North Dakota, come back in quarantine rather than go to work when you come back. And these are the kinds of things that this is not out of control yet. We're still just at averaging 4 or 5 cases a day per 100,000, which is half of what the national rate is, the entire national rate, even with low cases in New England. So this is not out of control yet, but I can tell you, we go to another few weeks and we go from 3 cases to 8 cases to 20 cases to 30 cases to 50 cases to 100 cases, it will soon get out of control. I mean, this one school case, they had 67 contacts. So this means that one of our staff members is going to call, one of our allied staff members is going to call each of those 67 families every day for the next 2 weeks. It's basically a full-time job, just in the one case. And so we don't have infinite people to call infinite others about doing this. But I think we can, I really think we can get this under control. Again, being really careful about those gatherings, about the size of the gatherings, and the cumulative number of contacts you have. So again, I look really, really carefully at myself and I say, well, how many contacts do I have in a given week? It's very small. It always could be counted on the fingers of one hand. Because I do not want to be giving this to other people or getting it from other people. So we try really hard to limit those contacts. Okay, let's see if there are more questions here. All right, so no other questions so far. We'll call that a night. That's perfectly fine. So again, remember, we're going to do it Friday at 4 o'clock. And Friday at 4 o'clock gives our staff a chance to maybe have one Friday night with their family. And still gives you a chance to ask questions at 4 o'clock. And then if you say, well, 4 o'clock doesn't work for me because I'm at work, then put your questions in the Facebook questions at douglaspublichousenetwork.org. And then we'll answer those questions. And then you can listen to the answers to those questions at 6 o'clock at your regular viewing time. Again, this is Dr. Bob Dannenhoffer, the Public Health Officer of Douglas County. Be safe, be kind.